Hello students, today we will discuss about the anatomy of quadratus lumborum muscle. Now this topic is very important to understand the thoracolumbar fascia. So whenever you are reading the posterior abdominal wall, you know that there are three muscles which are present from medial to lateral. You have psoas major, then you will have this quadratus lumborum and transversus abdominis. But my dear students, you have to understand this concept that these muscles, particularly the quadratus lumborum, is present in a compartment formed by your thoracolumbar fascia. So when you are reading the thoracolumbar fascia, before that you should know the basic concepts about the quadratus lumborum muscle. So when you will see the quadratus word in your anatomy, this is very commonly asked question, which are the muscles starts with quadratus. That means which are the muscles which are rectangular in shape. You know that rectangular shape in anatomy we are using the prefix quadratus. So there are four muscles where you are having this quadratus word. So what are these four muscles? One is quadratus femoris. You know where is the quadratus femoris? It is present in the hip area where you will find the quadratus femoris deep to the gluteus maximus muscle. So this is the first quadratus. Second quadratus is quadratus plantae. Now most of the students miss this muscle. Why they miss this muscle? Because its name is flexor digitorum accessorius. But when you will see the shape of the flexor digitorum accessorius, it is again rectangular, which is a muscle of the sole. And you can see this muscle which is present in the sole is known as quadratus plantae, which is another name of the muscle. Then what is the another quadratus? Now you have one muscle in your upper limb is known as pronator quadratus. Now this muscle is present in the lower part of the forearm, deep to the muscles of your superficial compartment of forearm. So this is the flexor muscle, flexor compartment muscle. It is a deep muscle and it causes pronation, and this is present here is pronator quadratus. Then the fourth muscle we are reading today is again the quadrate muscle is known as quadratus lumborum. So my dear friends, whenever you are having this question in exam, which are the rectangular muscles, or you are having the quadratus word in the muscle, quadratus femoris and quadratus plantae of the lower limb, pronator quadratus of the upper limb, and quadratus lumborum in the posterior wall of abdomen. So now let's start with the quadratus lumborum. So when you will see the quadratus lumborum, as I already told you that quadratus lumborum is a muscle of posterior abdominal wall. So this is the first question where you will find this muscle. The second question is that what is the relation of the muscle on the posterior abdominal wall? So you should always keep this thing in mind that when you will come from medial to lateral, you are having the psoas major medial most and along with the minor which may be present. Second is the iliacus, and the third is your quadratus lumborum. Now along this iliacus muscle is basically not present in the upper part, it is a muscle of the lower part. So if you are having this iliacus word in your books, then you have to understand that you are not talking exactly in the lumbar region, you are talking about in the lower part of posterior abdominal wall. But when you will see this image, now in this image you will find that there are muscles which are actually lies in the gap between the lower part of your rib and upper part of the iliac crest. And these muscles from medial to lateral is, this is the first muscle is your psoas major with the minor. This is the quadratus lumborum which we are going to discuss today, and this is your transversus abdominis. Now the other important thing is that it is a flat sheet, and this sheet lies in the paravertebral gutter in lumbar region. Now my dear students, you have to keep this thing in mind that which muscle is here in paravertebral gutter. Now when you are reading the colon, ascending colon or descending colon, we always say that colons are present in the paravertebral gutter and they posteriorly related with which muscle? Answer is quadratus lumborum. Why? Because you have to understand this concept that the quadratus lumborum is present here, and this area is responsible or formation of your paravertebral gutter. That means your colons are present here in this part of your abdominal area. Clear? Then you will have the second important thing is that the margins of your quadratus lumborum is having medially related with the psoas muscle and laterally it is related with transversus abdominis, which you can see here again that if you will mark the muscle which is known as quadratus lumborum, where is the muscle? This is your quadratus lumborum. So this lateral border is joining with this transversus abdominis and this medial border is related with the psoas major muscle. The next point is that when you will see the origin insertion of the muscle, most of the time you are having the origin in cranial part and lower part is the insertion. For example, if you will see the upper limb, you will have origin here, insertion here, origin here, insertion here. But this is the muscle which generally we are talking about that its origin is below and the insertion is above. That means if you can see this muscle, this is the lower part and this area is the origin and this area is the insertion. So let's discuss the remaining part of the, what are the another facts about this muscle is that it lies in the anterior compartment of lumbar fascia. Now see, there are two things, one is anterior abdominal wall, one is posterior abdominal wall, and in the posterior abdominal wall it is present in anterior compartment. Now this anterior compartment means what? It means we are talking about the thoracolumbar fascia compartments. So that's why I am saying again and again that whenever you are reading the thoracolumbar fascia in posterior abdominal wall, you should always have the idea about this quadratus lumborum muscle. So my dear friends, it lies in the anterior compartment. Now where is the lumbar fascia or thoracolumbar fascia? Now this is the transverse section of your abdominal cavity. Now in this transverse section, you can see that this is the posterior side, you will have the vertebral column. This is your anterior side where you can see two rectus abdominis. Now in this posterior side, if you will trace the quadratus lumborum muscle, now this is your quadratus lumborum muscle. Now this quadratus lumborum muscle is covered by the fascia. Now where is the fascia? Now when you will see the fascia, now this is your anterior layer of the fascia, this is your middle layer of the fascia. Now this fascia is having three layers, these are the two layers, anterior and middle, and this is your posterior layer. Clear? Now these two fascias are forming a compartment and this compartment is here and this compartment is known as anterior compartment, which is present between the anterior layer and middle layer of thoracolumbar fascia. So this is the question for your exam, that what compartment or what is the facial covering of quadratus lumborum? So what is the facial covering of quadratus lumborum? Thoracolumbar fascia. But which layer of thoracolumbar fascia? Anterior and middle. Now you have to understand, it is not posterior, it is anterior and middle layer of thoracolumbar fascia. So what is the origin? Now as I already told you that origin is from below. Now when you will have the hip bone, you have to understand that hip bone is having the iliac crest, and this iliac crest is divided into the two part. Origin of the transversus abdominis in anterior 2/3 and origin of quadratus lumborum in posterior 1/3. But on which part? Answer is your inner lip of iliac crest. So here you can see that this is the inner lip of iliac crest. Now we have seen this inner lip is divided into the two part, anterior 2/3, posterior 1/3. Now this posterior 1/3 pink area is giving origin to the quadratus lumborum. So this is the first thing, that if I will draw a quadrangular structure here, I will draw a quadrangular structure, you have to understand that this is the one border of this quadrangular and this is the another border of the quadrangular. Now this lower border of the quadrangular is attached on the hip bone and this is known as the origin from your hip bone. And which part of the hip bone? Answer is posterior 1/3 of inner lip of iliac crest. Clear? Now apart from that, there are few more origins. This is the major origin. Now the other origins are from the iliolumbar ligament. Now let's see first what is iliolumbar ligament. So here in this image, if you will see the iliolumbar ligament, iliolumbar is a connection between the ilium and the transverse process of L5. So here you will find that iliolumbar ligament is present here. Now here you can appreciate the presence of this ligament. This green color is your iliolumbar ligament. Now this muscle is not only taking origin from this part of your iliac crest or from hip bone, you can see that these fibers are also taking origin from the iliolumbar ligament. Clear? So my dear friends, it will give you the idea in exam also. Suppose you are having the question, where is the attachment of iliolumbar ligament? So now you can see that you have to first trace the inner border of iliac crest. Posterior 1/3 is giving origin to the Quadratus lumborum, and adjacent to this origin you are having the attachment of your iliolumbar ligament on hip bone. So my dear friends, first origin is, you have to write down the major is from the hip bone. Second is the adjacent part or of the muscle taking origin from the iliolumbar ligament, and third origin is the transverse process of L5. So these are the major origin area. Now what is about the insertion of this muscle? Now when you will see the muscle, as I already told you, the muscle is going upward after taking origin. So first, again I am saying that the origin is from which areas? First is the hip bone, then you will have a connection is iliolumbar ligament and the transverse process of L5. So this lower part is now known as, this area is the origin of your Quadratus lumborum. So iliolumbar ligament is a triangular strong ligament which extends from the transverse process of L5 to the posterior part of the inner lip of iliac crest. So again here this question is now here, which you can reply from this slide, that what is the attachment of iliolumbar ligament on hip bone. So you have to understand that iliolumbar ligament give continuous origin of Quadratus lumborum. So you have to just mark the point behind the origin of Quadratus lumborum on inner lip of iliac crest. Now what is the insertion? So when you will see the insertion of your Quadratus lumborum, it insert on the transverse processes of upper 4 lumbar vertebrae and medial half of the lower border of anterior surface of 12th rib. So there are two insertion. First is the transverse process of 1 to 4 lumbar vertebrae plus 12th rib. So when you will see this image, now here you can see that where is the insertion. So this is the major insertion on the 12th rib. You can see here. Now this is the posterior view. You can see from the posterior side, you can appreciate the spines of your vertebral column. And when you will see the insertion, you will find that it is also inserting on the transverse processes of lumbar vertebrae. So what is the insertion? Major insertion is on the 12th rib, lower border plus the transverse processes of lumbar vertebrae. Now, what are the relations with lateral arcuate ligament? Now see, this is again the concept to understand that whenever we are talking about the relations of diaphragm, we always read that diaphragm is having the lateral and medial arcuate ligament and median arcuate ligament. Now you have to understand that in my class of the psoas major fascia, I told you that psoas major fascia modify in upper part as a medial arcuate ligament. Now you read the lateral arcuate ligament. Now you have to understand that lateral arcuate ligament is again a modification of some fascia of posterior abdominal wall that we will discuss. The another important thing is that when you are writing the relations, you will see that medial arcuate ligament related with the psoas major, and you know that next to psoas major you have this muscle Quadratus lumborum. So lateral arcuate ligament related with the Quadratus lumborum. Clear? So this word has to be clear in your mind that whenever somebody will ask you lateral arcuate ligament, you have to understand that below the lateral arcuate ligament, you will find a muscle, and this is your lateral arcuate ligament, and this muscle is your quadratus lumborum. So, what is the lateral arcuate ligament basically? So, lateral arcuate ligament is the modification of anterior layer of thoracolumbar fascia. So, it is thickened between the transverse process of the first lumbar vertebrae and tip of the 12th rib, and it forms the lateral arcuate ligament. As I just told you in the transverse section of abdominal cavity, that this muscle is covered by the anterior layer and the middle layer from the posterior side. And this anterior layer, when approaches in the upper part, it extends from the tip of the transverse process of L1. Now, where is the L1? This is 5, 4, 3, 2, 1. Now, when you will reach here, now behind this, at this point somewhere, you will find the transverse processes of L1. Now, from these transverse processes of L1, you are having a modification till the tip of your 12th rib, which is present here. Now, suppose this is your 12th rib behind. So, this extension from the transverse process of L1 to the tip of 12th rib, you are having this thickening of the anterior layer of thoracolumbar fascia is known as lateral arcuate ligament. Now, this ligament gives origin to the fibers of the diaphragm also, and the subcostal vessels and nerves passes into the posterior abdominal wall posterior to the ligament. So, when you will see the quadratus lumborum, why I am teaching this lateral arcuate ligament in this class of quadratus lumborum? Because, my dear friends, this is always the confusion in students, that they think this muscle is inserting in the lateral arcuate ligament. No. The muscle is not inserting. Actually, the anterior covering of your quadratus lumborum, which is known as anterior layer of thoracolumbar fascia, will merge with this lateral arcuate ligament, not the muscle. So, this is what you have to understand, that lateral arcuate ligament is a modification of anterior layer of your thoracolumbar fascia, while the quadratus lumborum insert on the rib behind the fascia. Clear? So, if you will see this image, this is the anterior view where you can see that this is the point of insertion which you can appreciate here. Now, this is the point of insertion. Now, this point of insertion is on the rib, and this is the quadratus lumborum insertion. But when you will talk about the lateral arcuate ligament, if I have to draw the lateral arcuate ligament, I will start from the tip of L1, which is here, to the tip of your T12, and I will draw it like this. Now, when I will draw like this, it seems like this muscle is inserting here. But my dear friend, it is not like that, because anteriorly you are having the covering which is known as anterior layer of thoracolumbar fascia. So, if I will draw the thoracolumbar fascia, you will realize that this fascia is having the modification is known as lateral arcuate ligament. Now, what is the nerve supply of the quadratus lumborum, which is very commonly asked MCQ in your exam? So, quadratus lumborum supplied by direct branches from your ventral rami of upper 4 lumbar nerve. So, it is a direct branch from the direct branch of the upper 4 lumbar nerves. So, here you can see in this image that there are some direct branches which are supplying to your quadratus lumborum muscle. Then you will have the action. Now, what the quadratus lumborum will do? Now, you have to first understand that this muscle basically fixes the 12th rib. Now, this fixing of the 12th rib is necessary when you are doing the movement of your diaphragm at the time of inspiration. So, this muscle is basically helpful in the respiration or in the particularly in the inspiration also by fixing your 12th rib. Second action is that apart from this, if you will see, when the pelvis is fixed, it may causes lateral flexion of the vertebral column. So, there are two different actions. One is action on the basis of the rib. Now, this attachment on the rib is responsible for the respiration, because this part is also giving origin to the diaphragm. But when you will talk about the another site of the insertion, that means if you will talk about the attachment on the vertebral column, then it is responsible for the lateral flexion on one side if there is a unilateral contraction like this. Then you have the muscle of both sides, then it can extend the lumbar vertebral column. That means it is not a flexor. While you have seen the psoas major is causing flexion, but quadratus lumborum is not causing flexion. It may cause extension at lumbar vertebral column. Now, there is one important relation about the quadratus lumborum muscle. Whenever you are reading the kidneys, now again this is the question of your exam. On the posterior surface of the kidney, you always have the three muscles from medial to lateral, psoas major, quadratus lumborum and transversus abdominis. Now again I will say you that when you are reading the kidneys or you are reading your ascending descending colon, you always use this word paravertebral gutter. So this muscle anteriorly related with the kidneys and ascending colon on the right side and descending colon on the left side. Now in this image you can see that if you will place your colons in the abdomen and your kidneys, then you will realize that this is your outline of the quadratus lumborum muscle. Now this outline of quadratus lumborum muscle is overlapped by the kidney as well as your colon. Clear? So here you can see that this is a relation with the descending colon here, and this is the relation with the ascending colon here, this is the relation with the right kidney, here is the relation with the left kidney. So this is the posterior view. Now this posterior view is showing again that posterior to the kidney, this is your quadratus lumborum muscle here, and this is the quadratus lumborum muscle here. So sometimes you may have this question that if I am removing the kidney from posterior side, if I am having the surgery and I have to go to approach the kidney from posterior side, which muscles we have to remove? So you have to remove the quadratus lumborum, and I already told you that quadratus lumborum is enclosed into the anterior compartment of thoracolumbar fascia. So you have to remove the remaining layer of the thoracolumbar fascia, the muscles of the posterior part, that is the erector spinae. Then you have to remove the middle layer which will come first. Then you have to remove the quadratus lumborum muscle and then anterior layer of thoracolumbar fascia, and then you will approach to this kidney. Clear? So now at the end of this session, you are able to understand what is quadratus lumborum muscle, what is the origin, which is more important because the origin is from lower part, what is the insertion, that is on the 12th rib, and the most important thing is that which compartment of thoracolumbar fascia accommodate your quadratus lumborum muscle, what is lateral arcuate ligament, and what are the relations of abdominal organs with this muscle. So this is all for this session. Thank you.